First comes the cases, followed by the hospitalizations, and deaths soon follow.
New concerns tonight over the third wave of the pandemic that's consuming our hospitals. Infectious disease experts say the summer surge hints at what's to come. It started in mid-June. 10 days later, hospitalizations started to spike. Then about 2 weeks after that, deaths began to rise. Tonight, experts say data from the third wave shows a similar trend, and it may last for several weeks.
Across the region, we are seeing spike in the cases. The graphs that you see here are the most closely watched counties in our area. You can see the dramatic rise in cases starting in October. Since then, hospitalization records have followed consistently. Now, 9 months into the pandemic, healthcare professionals are being pushed to the brink.
Tonight, they're trying to drive home the seriousness of this situation.
I hope that the last moments of your life don't look like this. This is what you'll see at the end of your life if we don't start wearing masks when we're out in public, when we don't practice social distancing.
Dr. Ken Remy says he has seen it all inside the local intensive care units this year, and he's far from the only one.
News 4's Alexis Zotos joins us live from SLU Hospital tonight. Alexis, these healthcare professionals are pulling back the curtain tonight.
That is right. Right now, 53 patients are being treated for COVID-19 here at St. Louis University Hospital. That ranges from those in the ICU on ventilators to a mom of 5 who really hopes to be released in a few days from now. She and some of these medical professionals are talking to us tonight, wanting us to bring awareness, bring you inside this hospital as this virus rages on. For 9 months, this has been Benjamin Crew's day to day.
Managing the ventilator is a lot of what I do. So the breathing machine that people are put on.
Suiting up in PPE, the respiratory therapist at the ICU at St. Louis University Hospital works to ensure the most severe COVID-19 patients can breathe.
It's just wearing to come in and take care of these people and see a lot of people just not taking this seriously outside of here. If only they could see what was going on.
SLU Hospital let our cameras into the ICU for the first time. Due to privacy rules, we can't show patients' faces, but each is battling against COVID-19. In this room, a young person in their early 20s is on a ventilator.
In the beginning, I wasn't seeing such young patients, and now lately we're getting patients in their 20s.
Nobody is 100% safe from the virus.
Dr. Gassam Kamal is currently treating 22 COVID-19 patients in SLU's ICU. They're at capacity. Every room is full. Some patients wait days in the ER to be moved into the ICU, where more extensive treatments can take place.
Around, I would say, 50-50 of between our COVIDs and the usual patients that we see on a day-to-day basis.
2 floors up and not in the ICU is Mary Daly. She was admitted for COVID-19 last Wednesday.
Well, I couldn't taste. I couldn't breathe too good. And my chest was hurting.
Due to her isolation, we FaceTimed with the 62-year-old mother of 5.
I don't know what to expect.
Alone, except for the medical staff, a nurse comforts her as she tears up.
Okay, well, if you want upset. I want us to be together.
The loneliness is the toughest part for these doctors and nurses to witness. Patients battling this virus and sometimes not surviving, all without their loved ones.
That's the most difficult part, I would say, of this pandemic.
It's really hard to feel a little helpless when you know you've done everything you can, and sometimes that's just not enough.
You could really sense the exhaustion and the frustration talking to those working on the front lines for so many months now. But you really could also see just how much they care. These nurses, doctors, therapists, they know they are really the only faces that some of these patients are getting to see. And especially this holiday week, the biggest message from everyone I talked to tonight was they are urging everyone to please minimize your gatherings. Don't get together in large groups. They really hope that they can minimize the spread of this virus and keep more of our community members out of the hospitals. Sam?
All right, Alexis Odos live for us at SLU Hospital tonight. Definitely some intimate testimony we haven't heard so far during this pandemic. Alexis, thank you.